Hello everyone, you're welcome to my channel. This is Next Stephanie. Okay, in today's video, we're going to be talking on pyelonephritis. So we are going to talk more on pyelonephritis, the types of pyelonephritis. We are going to talk on the signs and symptoms of pyelonephritis. How do you know you have pyelonephritis? All right, we are going to also talk on ways to manage pyelonephritis, and I'm going to also tell you more about the causes. What causes this pyelonephritis, the risk factors of pyelonephritis, and lastly, we're going to talk on the complication of this pyelonephritis. That is, if left untreated, what definitely will happen. Okay, so let's go ahead. Pyelonephritis actually it is an inflammation of the kidney. Inflammation of the kidney. When we talk of the types of pyelonephritis, it just mean it's just in two types. You have the acute pyelonephritis and the chronic pyelonephritis. Acute pyelonephritis actually it is a sudden inflammation of the kidney, while chronic pyelonephritis it is a persistent inflammation of the kidney that has been there for a long period of time. What are the causes of pyelonephritis? Before we go to that, if you're new in this channel, do well to like, share, and also don't forget to ring the notification bell for more of this video. Thank you. The causes of pyelonephritis, which is definitely known as inflammation of the kidney, we have ascending bacteria. Ascending bacteria, this is when bacteria like Escherichia coli. This is when ascending bacteria. What do you mean of ascending bacteria? If you watch in our last video, we spoke on the various parts of the urinary system, where we spoke of the left and right kidney, which is above. We after that down we have the ureter. The ureter is the tube that runs from the kidney to the bladder. There is the third is the bladder, and then from the bladder we have the urethra. The urethra is the tube that runs from the bladder, that is takes urine out of the bladder and send it out of the body. So there is the tube that send urine, the urethra. There is from if we want to take it down and down right up, we start from the urethra, the bladder, the ureter, and the kidney. So now when we talk on ascending bacteria, we mean this is when bacteria leaves maybe from the urethra and enters the bladder. From the bladder it leaves and goes up, right? It leaves and pass through the ureter, and from there to the kidney, which will definitely causes accumulation. When the bacteria accumulate in the kidney, it will definitely lead to inflammation of the kidney. All right, so that is where we talk on there is ascending bacteria. We mean bacteria leaves and enters and goes up to the kidney. Okay. Another cause of this inflammation of the kidney, we can also talk of frequent holding of urine. I remember in one of my video I spoke on the reason why it is not advisable to keep urine or hold pee for a very long period of time, because maybe that urine has bacteria, and so it will definitely lead to, when the bladder is full, it can actually goes up back through the ureter and enter the kidney, and there it will lead to inflammation of the kidney. All right, there's so many bacteria that causes inflammation of the kidney or pyelonephritis, but that is just the one I want you to know. Yeah, I will tell you in another video more of this bacteria. Okay, now let's move down now to the signs and symptoms of this pyelonephritis. Okay, the first signs and symptoms of pyelonephritis that we have here is fever and chills. Okay, the third we have frank pain and lower abdominal pain. Okay, the third we have muscles cramp and joint pain. We have muscles cramp and joint pain. Okay, the fourth that we have here is dysuria. There is difficulty urinating. Okay, the fifth that we have here is frequent and urgent urination. That is, you feel the urge to urinate frequently. Okay, then the symptom that we have here, which is the last sign of symptoms here, we have malaise, and we also have anorexia, which is definitely loss of appetite. Okay, now let's move down to the various ways to prevent this pyelonephritis. What are the various ways that we can prevent this pyelonephritis? First ways that we can prevent this pyelonephritis. First, we have proper hydration. There is a proper intake of water, like 4 to 6 glass of water a day. Proper intake of water, and also, okay, the feed that we have here is frequent and urgent urination. That is, you feel the urge to urinate frequently. Okay, then the symptom that we have here, which is the last sign of symptoms here, we have malaise, and we also have anorexia, which is definitely loss of appetite. Okay, now let's move down to the various ways to prevent this pyelonephritis. What are the various ways that we can prevent this pyelonephritis? First ways that we can prevent this pyelonephritis. First, we have proper hydration. There is a proper intake of water, like 4 to 6 glass of water a day. Proper intake of water, and also you urinate. There is urinate whenever you feel the urge to do so. You use the toilet whenever you feel the urge to do so. Help that we have here is you prevent using products that can definitely irritate or cause irritation of the urethra. Okay, then we also have proper exercise. You do regular exercise. It is very good, and it will keep the kidney intact, and also reduce some waste product that have accumulated in the body that can lead to inflammation of the kidney. And last, we have proper intake of vegetables and fruit. There is proper intake of vegetables and fruit will definitely help in this case. Okay, now we're going to talk now on the complication. If this pyelonephritis is left untreated, what can it lead to? What definitely will be the outcome if it's left untreated? We have acute kidney failure. It will lead to kidney failure, acute kidney failure. The second, it can also lead to kidney abscess. There is abscess can be formed in the kidney. And lastly, it can also lead to kidney stones. There is stones are being built up in the kidney. All right, so that is the few complications I just wanted to risk factor. What can lead to pyelonephritis? First, we have pregnancy. Actually, women actually experience this more than men. I forgot to tell you about that. Due to the fact that first, women have a short urethra, and so bacteria can easily leave and enter the kidney through the various routes in which I just mentioned above or before. Okay, so we have pregnancy due to the fact that when you're pregnant, your immune system are weak. So when you're pregnant, you can easily pick up bacteria and other organisms that will quickly rush into the kidney and causes inflammation of the kidney. We can also have cystitis. Cystitis is inflammation of the bladder. That is, when the bladder is inflamed, it can definitely lead to it can also be due to bacterial infection, which will definitely live there and enters the kidney. Okay, the next that we have here is enlargement of the prostate. Enlargement of the prostate. The prostate is a gland. There is an enlargement of the prostate gland. This will definitely not allow urine to pass out of the body, and so it will return urine into the kidney, which will definitely lead to accumulation of bacteria, which can lead to inflammation of the kidney. Okay, and the last that we have is catheterization. This is when someone uses a catheter to send out urine. It is very advisable to always see a health personnel to clean the area, to make sure that the area is clean. so the bacteria cannot leave from there and enters the urethra, which will definitely ascend into the kidney. All right, so that is all what we have for today's video. If you enjoyed this video, please don't forget to leave a comment. Thank you for watching. Bye. See you in my next video.